All right, going on to slide 100, hypertensive disorders in pregnancy. I just want you to think about some of the things that a patient might come in with. They could have chronic hypertension prior to ever being pregnant. The term preeclampsia, we're going to go into eclampsia and gestational hypertension. So first talking about preeclampsia on slide 101. Preeclampsia, what is it? It's a hypertensive disorder. It includes multiple systems within the body. The cause of it is actually unknown, but it is very specific to pregnancy. And it basically involves reduced organ perfusion secondary to vasospasms. It's a disease only in pregnancy, and it's kind of classified as mild to severe. And it can have severe maternal and fetal impacts as well. There's many risk factors. We, don't always know exactly what causes one person to have preeclampsia versus another, but nulliparity is one of the risk factors. A woman that's younger than 19 or greater than 35. Someone that is obese. Multiple gestation pregnancy, such as someone carrying twins or triplets. Also a family history. And if somebody has pre-existing hypertension or any renal disease prior to becoming pregnant, they're at risk also. And then we also learned about our diabetes or gestational diabetics. Both of them are greater risk as well. Risks for the woman. Cerebral edema, hemorrhage, stroke. She can go into DIC, pulmonary edema, congestive heart failure, hepatic failure, renal failure, and have an abruption as well, seizures, and death. The book kind of goes into the risks for the fetus and newborn. Prematurity, you guys know, carries lots of risks for the baby themselves. Also, somebody that has IUGR. When we think of the constriction component, the hypertension, which is reducing organ perfusion, remember, think of that placenta as an organ as well. We're decreasing blood flow to that baby as well. We could have a fetus that's born with IUGR, which is that intrauterine growth restriction. They could also have a low birth weight. And also, they're at a greater risk of fetal, intolerance to labor as well. So many times we'll have a mom come in. She might be an induction that has mild preeclampsia, and we don't want it to get worse. And she comes in, and we start inducing her, and baby can't tolerate it because there's many times not enough perfusion to that placenta. So she could end up having a C-section instead. You can kind of look through, let's see, on slide 102, it's just